Hello, Mac Performance family. Welcome back to our weekly Tuesday Night Lives information sessions. Tonight is all about the ankle. For those who don't know me, I'm Melissa MacDonald. I'm a sports chiropractor. I go by Dr. Mac. And tonight, we're really going to take a deep dive into the foot and ankle and really what happens when we have chronic ankle sprains. Now, I'm sorry about some of the weird lighting right now. It's all going to make sense in a minute. We're going to be getting on the floor and getting in with a foot because that's really the best way to understand what's going on. And I'm going to apologize if I sound a little bit under the weather. I'm actually doing much better. Last week's light cough turned into a pretty horrific illness, and I kind of did not sound good. Now I'm all better, minus a cough and kind of sounding sick. But with the ankle, the human foot and ankle is composed of 26 bones. 26. In that tiny itty bitty space, 33 joints and over 100 muscles. I mean, when you really think about it, that makes sense when we're a lot of person on a very tiny footprint, and that footprint has to hold us up. But ankle injuries, because of the style that our joint is made, are super common. In fact, it's the most common injury, accounting for 2 million per year. It is one of the most common injuries in America when it comes to musculoskeletal, and it's not because of sports. A lot of injuries simply come from us walking and misstepping our steps. So most people at some point in their life will have experienced an ankle injury. I'm going to go ahead and get the live up and running so that I can see who we have with us. Hey, Shiloh. Hey, Ashley. Hey, Tim. Nice to see you guys. I am feeling better, Tim. What we're going to do is we're going to get right into the ankle right now. So we're going to go ahead and move to the floor, because this is going to be the easiest way to teach and talk about the ankle, is to get into the foot and ankle and see what's going on. Now, right here we have the outside of the foot. This is the inside of the foot. When we're talking about an ankle sprain, our biggest concern is our lateral foot, in particular the ligaments that run right here. Because when we grab the wall, lift your foot up, when you roll your ankle in, all of these tissues are put on tension, and this is where you're going to tear or potentially pop the ligament off the bottom and fracture the base of that foot. Now, there are 3 main bones of your ankle. Go ahead and turn toward the camera. You have the bigger bone, the tibia, this little bone out here, the fibula, and then we have the talus. And this creates the true ankle joint. The rest of the bones are all found within the foot. And that makes a great dynamic structure that supports all our weight and distributes that energy and allows us to walk and run and jump. But it also leaves us open to injury. And once it's injured, it is a pain to get back to health. Because how often has it been when in the past you roll your ankle, you're put in a boot, you're put on crutches, and you're stuck like that for 6 to 8 weeks. And that is all you're going to do for those 6 to 8 weeks is simply walk on a crutch and not weight bear. Well, guess how our foot and tissues heal? They heal with loading. So we need to make sure we're appropriately loading the foot through those injury phases. And at this point in time, it's not an acute injury. We can be years past our ankle injuries. Last time I rolled my ankle significantly was in college, and that was 10 years ago. But I still have issues that I have to work through to increase stability, because I can't tell you the number of times I have patients come in and say, hey, I have weak ankles, I can't do this, I can't do that, I'm struggling with this. Now, Andrew here, granted you're only going to really see his foot, doesn't have ankle injuries or issues the way I did because he played hockey. And hockey doesn't allow you to get a lower ankle sprain. It's really going to only cause a high ankle sprain, and that is a different injury than what we're going to be covering tonight. So we're really going to be focusing on our most common injury, this lateral inversion ankle sprain. Inversion being this internal motion of the foot where we damage these outside ankles. It's really hard to get an eversion sprain or an outside sprain where we damage the inside of the ankle, because it's just not the mechanism of injury that occurs. Now, what we're going to look at is a lot of times once we have an ankle injury, this part of our foot, the arch, go ahead and turn the inside. So this arch of our foot, we start to lose that integrity, and it starts to drop out. It starts to have our ankle just kind of roll in, or what we would call supinate. And this puts a lot of extra lot of tension on our plantar fascia. The plantar fascia is simply the ligaments of our calf muscles coming down, going across the bottom of the foot and attaching, which is great, except for when we lose our arch and they become inflamed and become plantar fasciitis. Plantar fasciitis pain is the worst. In the morning, you get up and it feels like you're walking on ground glass. Just excruciating pain. So what you can do to treat that is short foot exercises. With your heel firmly planted in the ground, you're going to pick up your front of your foot and your toes, retract back, plant the foot down, relax the toes down, and create this arch. And then you simply are just going to stand there. You're going to stand with your foot with the points going through your little toe, through your big toe, weight through the heel, along the lateral side, really creating the ideal foot position. You're trying to create the perfect foot so that you don't have any pain or dysfunction. And just by creating this short foot, you start to reestablish your foot integrity. Now, this is the very basic start of how to start loading this. When you're having pain, you can do the ABCs, which is literally taking your foot and drawing out the letters to create mobility without having any weight bearing, because we don't want to lose any range of motion. Range of motion that is lost with ankle sprains is dorsiflexion. Dorsiflexion is the ability of the ankle to lift up, or when flat, push the knee forward while keeping the foot and heel locked in. It's literally the most common reason that someone can't effectively squat, because their ankles don't allow them to go down, keeping their heels on the ground and allowing their hips to rock back. So this right here starts to reestablish foot stability so that we can start working on the other areas. Once we have established a strong short foot, we move to this delightful thing, the star drill. Now, I'm going to have Andrew step with his foot directly in the middle of the star drill. Create a nice short foot with that foot. And once he's here, I'm simply going to have him balance on one leg. That's it. By balancing, we're starting to create some proprioceptive stressors to try and retrain these muscles to know where it is in space. When we have an injury, we lose that. Now, we're keeping it on a firm surface. Very few sports are played on foam or played on an unstable surface. So we're going to start with a nice firm surface, and we're going to work from here. Once he is able to maintain this position and maintain balance for around 20 to 30 seconds is where I like to see, with minimal wiggles, wobbles, reaches out, and instability, which if anybody's having ankle injury, you know that's a lot of work. And again, he has completely healthy ankles, so he can stand here pretty much all day single-footed with no issues. Once we get to here, then we start implementing some perturbations or stressors to improve proprioception. So he's going to start tapping each red line in a clockwise pattern, working his way around the star. Now, in this, he's tapping and fully letting his weight come down so that he's working through the different angles of the drill. As we progress, he can reach further, touch more lightly, and really work on, and slow, really work on developing some awareness of where this joint is in space. Now, if this is a hockey player, it's going to be a little hard to implement his gear into doing a balance drill because he's wearing skates. So if we're starting to progress to sport specifics and it's a hockey player, I'm going to toss him in skates, take him to the rink, and have him do some single foot drills. If it's a football player, I'm going to make sure I have them in cleats working through these drills because that's where they need to be training functionally to get their foot managed and have the ability for them to function at the highest level for their sport. Now, can we use bracing? Can we use tape to help create some of this proprioception? Yes. Now, I'm going to say something very controversial. And this is coming from the fact that I work with sports teams. I do a lot of pregame taping. White tape does nothing. It is crap. Every research article out there says after 15 minutes, white taping is next to useless. But athletes like it, and they're going to have me do it anyways. But it is useless. So what do they theorize the white tape does? Well, anything that we apply to the skin in this area is going to help with proprioception. When we help with that brain awareness, where the joint is in space, we decrease pain and we improve function. So putting tape on here can actually help the athlete prevent injury, not because the tape is providing stability, but because the tape is helping the body know where it is in space. And that in and of itself helps the athlete feel better. Now, if you're just generally dealing with weak ankles, you want to wear high heels and aren't able to, or just feel unstable in walking in your shoes, you can use these same concepts in wearing the shoes you want to wear and practicing balance work. Don't get crazy on the balance work in heels. I mean, if you want to and then become patient because you've injured yourself, I'm okay with that. But really, we're looking at trying to create some functionality with strengthening our joints. Then we want to move into functional things. Single leg lunges, calf raises, working through that joint and getting into activities that you need to do. So if there's something you're avoiding because you don't feel like you have the strength to do, this is where you can start to modify and play with these. Once I have someone in this position, they're able to do the star drill like a champion, I might add, while they're balancing, I might add, so go ahead and balance. So I might add some instability work where I'm tapping or hitting their leg. I might do it to their shoulders because that greater movement creates greater instability. I might add something called a slosh bar, which is simply a PVC pipe full of water so that it sloshes back and forth and creates instability, and have them do movement drills with that. But I'm never going to unstabilize the ground. So back to the nerd view. When it comes to destabilizing the ground, research is showing that that's not training our ankles or increasing proprioception. that's really an effective treatment method for a concussion because it trains our ears. When we destabilize the surface, we're working a different system called the vestibular cochlear system, which is simply the balance sensations in our ears. So we actually can sometimes make this worse, which means a lot of the rehab we did with pads and balances actually left our ankles more exposed to injury, which could be why we're having so many issues now that we're older, because when we were going through high school back in the 90s, 2000s, that's all the rehab that they had available to us. And now as a provider in the field, I'm having to figure out how to fix it. And this is where I like to start. These short foot exercises, these star drills that you can do at home and start building up the strength in our ankles to really help bring awareness of our body on what we need to do here. Now, when it comes to, hey Madison, I see we have a bunch of people tuning in tonight. See, we got Aaron and Dan and Moose and Amanda and Steve. I'm so excited to have you guys here. We're really looking at the ankle and chronic ankle injuries and what it has done long-term to affect people and what you can do. So we went over short foot, we went over star drill. Some additional things that I want to talk about is how to recover after activity. A lot of times with chronic ankle injuries, after working out, you have a lot of soreness and your ankles can hurt, and the first thing you want to grab is the ice. Don't do that. Do not grab the ice. This is not an acute injury. And a lot of times it's just a soreness or an achiness that you're feeling. So you want to grab heat. Grab some nice warm water bath, add some Epsom salts, and just soak your feet. That's going to give you the fastest recovery. Because ultimately, when training the hardest, the athletes that are going to perform the best are the athletes that can recover the fastest between training sessions so they can train the hardest at every session. Now, I did see a question. Are there any exercises to keep my arches from falling inward? Yes, Rachel, we went over that with the short foot exercise about 5 minutes ago. But short foot exercises, I'll put up a separate video so you don't have to sort through the feed to figure out what that is. But the goal of the short foot exercise is to bring the toes towards the heel, splay them out and relax them while still holding a nice firm arch and allowing that arch just to hold. Because when you're looking at architecture, arches are one of the strongest pieces of architecture we have out there. They just stand the test of time. The issue with our feet is it's a very strong joint, but there's a lot of muscles and ligaments involved. And as we age and accrue injuries, the tiny muscles in our feet weaken. The other thing to a short foot exercise that you can do is something called towel drags. And towel drags, or scrunchy toes is the other name I like to call them, is simply where you have a towel on the ground, you place your bare foot, and you scrunch the towel up with your toes and then press the towel out with your toes. And this works those muscles, and it's starting to re-solidify getting that arch in place. So top 2 exercises I provide my plantar fasciitis patients are short foot and scrunchy toes or towel drags. Shrinking. So the question is are there exercises to keep my feet from shrinking in my skate? That more sounds like you have a poorly fitted skate, because your feet should not shrink once it's in it, to be completely honest. That sounds like a more misfitted piece of equipment than a foot injury. And I looked to my left because I was asking Andrew, questioning with my eyes, because he's played hockey for 26 years ish, if you count the fact that he at least had to learn kind of how to walk first before he could put skates on. And since toes curl in your skate. So yeah, that sounds more like a misfitted skate with weak arches, to be honest. But I'll be at the rink tonight, and I'll check it out if you're there. When it comes to our feet, so I want to get back on here. If you're watching this live, hashtag live. If you're watching this on replay, hashtag replay. We talked about recovery using heat, basic exercises of our ABCs as our initial exercise post-injury, but we're really talking about those chronic ankle, chronic weak ankles. So we want to create stability, reestablish proprioception, and reestablish the proprioception, which is our body's awareness of the ankle. And we do that through balance exercises, such as the star drill, which you can see a little bit of the tape in the background. And that's just red gaffer's tape. You can use painter's tape. You can use chalk, whatever, just to give you something to play with proprioceptively. Once you are well established barefoot into a star drill, you add in whatever piece of equipment you're going to be wearing, whether that's shoes, whether that's sneakers, cleats, whatever you're going to be wearing to do the activity that you're feeling weak, that's where you want to add it. Ankles are challenging because of the anatomy of them, because there's so much going on, and it's so hard when the initial injury occurred to actually rest the ankle, because we have to walk, we have to keep moving, we have to keep going. I have quite a few people that come in with knee pain, and it's really their feet and ankles that have become so unstable that their body's creating pain up to the knees. So if you're having knee pain and it's on the inside of your knee, but not quite at the knee joint, it might be interesting to try some of the short foot and scrunchy toes to see if that helps. The other thing that bothers our feet and are shoes. The shoes that we have now in American society, frankly, suck for our feet. Our feet, when you look at them without shoes on, are narrow at the heel and get wider as we go to the toe. So it's this nice inverted triangle. But when we look at our shoes, the heel sometimes can be the widest point as it gets more narrow towards the toes. This causes some major issue with our feet, from just bunions to plantar fasciitis and just overall pain. So by just changing the shape of our shoe, by getting a little bit of a wider toe box, sadly they're not always the cutest shoes, but getting a wider toe box for days when we know we're going to have to stand or be on our feet for long periods of time can help prevent some of the pain and dysfunction within our joints. When I'm here in the clinic by myself, a lot of times I'm walking around in just my socks because it's what's healthiest for my feet. Or when I'm working at a standing desk, I try to just work barefoot so that I can allow my feet to spread and have a natural position on the ground. I then can also work through my short foot exercises. Are there any other questions tonight? Again, if you're watching live, hashtag live. If you're watching on replay, hashtag replay. If you have questions when you're watching on replay, go ahead and type them. I'll get back with you right away. I want these to be as informational as possible. And if you have a topic that you want to learn about, go ahead and tag what you want to hear next time. Next week, I think we're going to cover a chiropractic bread and butter topic because we haven't done it. We're going to talk about the low back. We're going to talk about what you can do to help your low back and how you can help your low back pain because, well, it's so common. It is one of the leading reasons people become disabled. And I've kind of been avoiding it because it's a bread and butter topic of chiropractic, but let's dive in. Let's talk about the low back. But if there's something else that is plaguing you that you want to hear about, go ahead and drop it in the comments. And I hope you got some information tonight about the ankle, whether it be short foot exercises, using Epsom salt soaks to recover from exercise, that you got something this evening. I have a question. How about exercises when you have tendinitis? So when you have tendinitis, this is an inflammation of the tendons. And tendons are structures that hold the muscles to the bone. They are not what we would call well vascularized, meaning they don't have good blood supply. So to actually get healing and get them moving, I like to keep them very, very warm, no ice, which it's an itis, it's inflamed. It is, but it can be because the tendon is unhealthy and starving for nutrients. So if we help get some of the nutrients there, and then I like to work them in isometric or static holds. So if you're having, let's say, Achilles tendonitis, so the big tendon that runs down the back of the calf, I like to do static isometric holds on a stair. So you have your feet on a stair, your heels are hanging off the back. You slowly lower your heels down and just engage the Achilles and just hold. And just statically hold that for 30 seconds, then rest, and then statically hold. That kind of steady loading combined with some soft tissue work really has been the best things that I've seen turn tendinitis into non-factors and get people back to movement and get people back to function. I hope that answered your question concerning tendinitis. If you really have a more specific question, go ahead and shoot the clinic an email or shoot the clinic a private message, and we'll get right to that. I saw we have another question. Are there any taping techniques that mimic a ankle foot orthosis brace? So an ankle foot orthosis brace are typically used in patients that are having trouble with controlling their foot through plantar and dorsiflexion movements. They're commonly seen in patients with cerebral palsy that have spasticity that doesn't allow their ankle to move, and it's a brace that wraps around the calf, hard brace going along the bottom of the back of the foot, and kind of just holds the foot in a neutral plane and doesn't actually allow it to plantar flex, because that's usually the position they're struggling to pull the foot out of. There are some taping techniques using Leuco tape or a brown tape that can hold the foot and mimic that type of orthotic, but the amount of skin traction and damage that can occur is not always beneficial. It's something that can be utilized to see if a potential orthotic would be beneficial to the individual, or prior to going in and actually going through the appointments and fittings to see if it would be helpful to have the patient get that type of ankle foot orthosis brace. I'm not seeing any other questions this evening. I hope, again, this was beneficial. We're at 30 minutes, and I don't like to take any more of your time this evening. I hope this was helpful. because here at Mobility Agility Chiropractic Performance, we like to help you get better faster, stay better longer, because ultimately none of us have time to be sidelined. Have a wonderful evening. We'll see you back next week at 6:30 CST for low back and low back pain and what we can do to help you get out of pain without having to seek non-conservative care. With that, have a good night and have a wonderful rest of your week.
To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.